Go.
Imagine being a child with an illness or disability who wants to attend school so badly, but you're told your medication can't be administered while at school. You have to choose between going to school to get your education while being in pain, which could and most likely would distract your learning, or staying home in solitude and attend school via robot because your school won't allow you to take your medication on school property. This is the drive behind the introduction of Connor's Courage Bill, which has been introduced into the Maryland House of Delegates as well as the Maryland State Senate. Every day, children who are prescribed medical cannabis in the state of Maryland are unable to have their medication dispensed to them by the school nurse. Medical cannabis is used to treat a number of ailments such as epilepsy, autism, and has also been proven to relieve symptoms of some rare diseases. Something else you may not know is that not all cannabis is about getting high. Now that I've mentioned medical cannabis in the state of Maryland, let's look at how other states handle this situation. According to a 2016 report from the Education Commission of the United States, only Colorado, New Jersey, Maine, and Washington State are allowing medical marijuana to be administered in school. Just recently, Washington, D.C. has been added to this list. A parent in the state of Maryland would have to sign their child out of school, take them off of school property, and give them their medication, then take them back to school and sign them back in. Connor's father, Michael Sheffield, describes the process as saying, "We have to leave work to go up there and sign him out of school property into our car to administer the order. Let him get a real quick swig of water, walk him back into school, and sign him back in." Not only does this disrupt the child's school day by having to physically remove the child from school and take them off grounds to administer their medication and then back to sign in, causing them to miss classroom instruction, but it causes problems for the parents as well. Not only is the child missing that time from class and instruction, but the parent is also missing that time for work. The parent has to leave their workplace, drive to their child's school, and go through the process I've just discussed, as well as miss any pay from the time they have to miss from work. Next, I'm going to share the story of Connor Sheffield and his rare disease. This is Connor. Connor is the child that the Connor's Courage Bill gets its name. Connor is the son of a personal friend of mine. He is a 15-year-old Maryland student, and he suffers from a rare disease called gastrointestinal dysmotility. Connor has been in and out of hospitals for many years. At one point, his family was even asked to discuss palliative care. 2 years ago, he was so frail and so sick. Connor was being treated for perforations in his back. At the time, the parents informed his mother that they couldn't administer any pain medication to Connor due to the lack of motility and the fact that opioid painkillers cause constipation in normal bowels. His mother described the feeling of complete helplessness that she felt in not being able to provide her child with relief while watching him slowly fade away. Tricia Sheffield, Connor's mom, expressed on the Connor's Courage Facebook page her feelings in seeing her child this way by saying, "I remember my son screaming in pain and moaning in horrific pain, and no one could do anything to help him. I couldn't bear his suffering and collapsed on the floor outside of his room begging for God or anyone to help him. Hearing someone you love screaming in pain and you can do nothing is complete torture to your soul." She goes on to discuss how she remembered thinking he was going to die, which was something neither could she control nor could she imagine anything to ease the pain associated. As a parent myself, the thought of this being expressed as her way of feeling makes my heart hurt. Friends of his family suggested he try medical cannabis. Today I will persuade you to contact your local delegate and senators and ask them to support the passage of Connor's Courage into law. I bet for some of you, when I say cannabis or marijuana, you instantly think of a stoner with a joint hanging out of his mouth. You just pictured that, didn't you? For children with medical marijuana or cannabis prescriptions, they don't picture it this way. Connor, for example, describes how he takes his dosage from a medical cannabis tincture every 4 hours to allow him to eat. Cannabis tincture is a concentrated liquid form of cannabis. Tinctures are often made with either oil or alcohol. Now I want to show you a picture of a young man living his life still with some bumps in the road of health, but much closer than he's ever been. Look at this smile. I'd like to tell you a little more about Connor and his condition. Connor suffers from a rare disease called gastrointestinal dysmotility, which is described by the National Institute of Health as a type of dysautonomia that may be idiopathic, meaning cause unknown, or associated with cancer elsewhere in the body. In a more personal and easier understanding wording, Connor recently described his condition on WMAR Channel 2 News story as follows. A very large portion of my intestinal tract, my gastrointestinal tract, doesn't work exactly the way the rest of everything should. On the website connorscourage.com, Connor describes himself and his condition more in depth, as well as what he has gone through to live his life with this sickness and the challenges he's faced in treating this condition with medical cannabis and not being able to receive it during the school day. Some may be uninformed on this issue and possibly think that cannabis use is all about just getting high. There's really much more to cannabis than just getting high. Mikhail Kogan, the medical director for George Washington University, describes CBD in a recent article by the Washington Post by saying, "This is a really powerful compound." He also says he's seen it work for a lot of his patients. The cannabis he prescribes is what they call a high CBD strain. Leafly.com explains the benefits of high CBD strains by saying, high CBD strains tend to deliver a very clear-headed, functional effect without the euphoric high associated with high THC strains. They explain that high CBD strain, which is what Connor uses, would also be a great choice for someone needing to medicate throughout the day to control their pain, inflammation, anxiety, and other chronic conditions. Now that I've explained the difference between high CBD and high THC, we'll revisit the pictures of Connor. At the conclusion of my speech, I will be passing out information on Connor's Courage bill, and I've included the contact information for our local delegate as well as our local senator. Connor's Courage bill seeks to allow medical cannabis to be administered in Maryland schools. I hope you'll join me in support of this bill, as it will help many children like Connor who only want to get an education and not be in pain while doing so. Very good.